Hello, this is Steven, and it's post-op day 11 for my jaw surgery stuff. And a lot to report today. First of all, I think most of the swelling has gone down. I still feel very puffy in places, especially on the left side and especially on the upper lip area. But most of the swelling, I believe, has gone down. Also, most of the bruising has gone away in just the last couple of days. I just have a little bit of bruising remaining that's visible on my face, at least on my lower chin here and here, but it's really dissipated a lot in the last 48 hours. I have a lot of bruising on my upper chest still. It's very dark in a horseshoe type pattern, but that'll go away as well. I am eating well. I've regained, well, I'm not too far below my pre-op weight right now. I have been eating a lot of liquids and soft foods like mashed potatoes, which I don't have to chew, and scrambled eggs, which I don't have to chew. I had some sushi the other night as well. And my lisp, I noticed that if I take my splint out of my mouth, I have no lisp at all. I can speak pretty normally. Now, I'm still a little sore. My skin still feels very stretched, which is kind of weird. And of course, I still have the numbness. Most all the numbness is still there. I've gotten used to dealing with it, which makes it a bit easier. But I have noticed that some areas have started to get better. Last time I reported that my lower lip was completely numb on the left side. Today I can report that some of that numbness has improved. The area that is completely dead has shrunk, and that's good news. Also, on the roof of my mouth, there's a very small area this morning, or actually starting last night, I could feel suddenly. That's an improvement. My teeth are still completely dead, however, I don't feel them, and the left side of my face is still very, very numb. I'm getting used to it, and so it doesn't bother me as much, because I've got very high hopes that it's all going to return back to normal. Eating is still difficult, like I said, because it's hard to open my mouth very wide. I can do it, but I have to do it very deliberately and slowly, so it's hard getting a big spoon in and so forth. But overall, I think I'm doing well, doing much better. I continue to have high hopes that the numbness is going to get better. Again, I haven't had much pain, just occasional soreness, which can wax and wane. But, and as you can see, my smile still doesn't feel very natural yet because everything feels so tight. But when I do smile, you can definitely see that my upper teeth are in front of my lower teeth. I'm going to try to put the camera to the side to see a side profile, and we're going to see how it's going to look. That's from my left side, and here's from my right side. So, I think I'm progressing along well, post-op day 11. I see the doctor tomorrow afternoon because he was pretty concerned about the numbness. So we'll go in and see him, see what he says, and we'll have a report in the next couple of days or so. That's it for now, and goodbye. Again, before that, I want to make another very heartfelt thanks to friends and family who have been supportive through the whole process. Without them, I never would have made it. Thank you again. Bye-bye.